Let me explain you about a hump nose and deviated nose. The reason why I explain about these two cases at the same time is that the surgical method is almost the same in many aspects. The first thing to consider during a hump nose surgery is whether it is a hump nose or pseudo-hump nose. These two types of noses look similar, but the surgical method is completely different. Therefore, distinguishing from one another is very important. Hawk nose, another name for hump nose, took its name after a beak of a hawk. Though pseudo-hump nose looks similar to a hump nose, the nasal root in between eye is relatively low, and thus the middle portion looks relatively protruded. And thus, in a hump nose, its size should be reduced. But in a pseudo-hump nose, it should be enlarged in a position. For a pseudo-hump nose, osteotomies are not necessary, but the nasal root, tip, and subnasal part should be protruded. The protruded portion of the midline is in the normal height. This is after surgery is done in between eyes and on the nasal tip. One of the features of a hump nose is the protruded medial dorsum and wide nasal bone in the frontal view. Though the nasal tips all look different, but they are downturned and lack of protrusion in general. Therefore, the first step of correction of a hump nose is removal of a hump. If the hump is removed, the nose will change like the photo. It is not a complete nasal look yet. At this time, nasal bone is narrowed by medial and lateral osteotomies. In many cases, as I told you earlier, the one with a hump nose has a downturned nasal tip, and usually the nose is lack of projection. In such case, nasal tip surgery is necessary based on the cause. The nasal tip should be projected forward and upturned at the same time. That means nasal tip should be rotated upward. Then, final result will look like this in this picture. One of the features of a hump nose is a dramatic result, though it looks rough before operation. Then I will explain you about the surgery procedure. This is a person with a hump nose. A surgical design is drawn on his nose, imagining the anatomical structure of his nose. This is a general anatomical design. Nasal bone, upper lateral cartilage, lower lateral cartilage. Then, nasal hump should be removed. In order to get rid of a hump, the degree of the hump should be diagnosed from the profile view, and it should be also estimated whether the hump needs to be removed or not. There are diverse ways to reduce the nasal dorsum, but according to the surgeon's experiences and preferences, different osteotomies or rasping, a method to grind a bone, can be used. Most surgeons tend to use osteotomy for a big hump and rasping for a small hump or for slight shape change. This is how to get rid of a hump by osteotomy, and the lower picture shows the hump taken out from the nose. You should understand that 2/3 of a nasal hump is composed of cartilage and 1/3 of bone. Therefore, the hump is mostly bony substance. After the hump removal, nasal bone shift or osteotomies are performed to gather the nasal bone. First, medial osteotomy is applied. In definition, medial osteotomy is a process of cutting and separating a nasal bone from a nasal septum, a bony septum which is located in the middle of a nose. Lateral osteotomies come after the medial osteotomies, in which the width of nose is narrowed, beautiful broad tip line is shaped, a deviated part is corrected, and the nasal roof is closed, which is open after the hump removal. You are watching the process of medial and lateral osteotomies. The surgeries not only narrow the nasal bone, But also, if the nasal bone is depressed and narrow, widen the narrowed nasal bone by shifting the nasal bone outward. Next, I will talk about a special rhinoplasty called spreader graft. After osteotomies, if nasal bone is narrowed too much, there can be airway obstruction. So, a cartilage should be grafted at 1/3 point of its height in order to widen inside of the nose and prevent it from getting too narrow. Like in picture A, after the hump is removed, the frontal portion of the nose is open as in the picture B, and thus the nasal bone should be gathered through lateral and medial osteotomies. Then the nasal bone may get very narrow like picture C. Spiral graft is a way to prevent such a symptom. As shown in this picture, a cartilage is grafted between nasal septum and upper lateral cartilage to prevent the nose from getting too narrow. This method is also useful when correcting deviated nose. Spreader graft can be applied on one side of the nose only, but in general, applied on both sides after hump removal. Finally, the whole rhinoplasty is wrapped up with a nasal tip surgery after the osteotomies. You are watching different results of operation after hump removal. The mid portion of the nose is protruded a lot in this person, and her nasal tip is lack of protrusion. This person is similar case as the previous one. This person had a fat injection as her forehead was depressed. Though her hump was very large and her nose looked very long in the frontal view, you can see her nasal hump was corrected. With nasal hump in the middle, the upper and lower portion is depressed, and thus the lateral nasal line is uneven. After the surgery, her profile line is well corrected, and in the 45-degree oblique view, also, she had a very feminine shape. Though the surgical method for a deviated nose is similar as a hump nose, the deviation correction should be added. I will explain how to correct this. Nasal septum takes the most important roles, which is located in the middle portion of a nose, in making one's nose deviated. Generally, as the nose gets deviated to the direction as the nasal septum goes, correcting nasal septum is the core of the surgery. Seen from the photo, his nasal bone is wide and its tip is deviated to the left side. From the profile view, it looks like a hump nose. Before operation, when designing for surgery, the nasal bone should be divided into upper and lower parts. Applying the same method as in a hump nose surgery, the hump in the middle should be removed by osteotomies. This kind of instrument is used. By medial and lateral osteotomies, nasal bone is shifted. These are the tools to be used in medial and lateral osteotomies. The red arrowed area should be saved from the osteotomies and should be pressed to be broken by fingers. That's how the nose don't move after the osteotomies and get stability. Septoplasty is as important as osteotomies for correcting deviated nose. Septoplasty is a procedure to relocate and deviated septal base to the right position. The deviated part of the midline should be corrected by septoplasty. If necessary, turbinoplasty is performed at the same time. The septal cartilage harvested through septoplasty is grafted at the opposite side of the deviated part as shown in the picture. When the deviation is not corrected completely by spreader graft, rotational suture method is applied, in which lateral and septal cartilages are rotated. This is right after the operation. After operation, it should look overcorrected. The preoperative view shows that his nose is deviated to the left, but the postoperative look to the right instead. The reason for this is because the nose is prone to go back to the original status, to the left in this case. Therefore, right after the operation, it should look as if it is overcorrected to guarantee the satisfactory result later on. The post-operative profile look is almost same as in the hump nose surgery. As he had a deviated nose, I will show his pre- and post-operative look. As shown in the left picture, his nose was deviated to the right severely before operation, but it is well corrected in the method previously explained above. This person's left side of the nose was severely depressed, and in opposition, the right side was protruded. His post-operative view seems to be corrected well. Seeing from the picture, his nose is deviated to the right and his cartilage is deviated to the left, and thus his nose looks like the letter C. In order to check if the deviation was corrected or right, it should be observed from the above. His nose was deviated before operation, but it was well corrected after surgery. Hump nose and deviated nose surgery belong to the most difficult cases of rhinoplasty. Especially the deviated nose surgery does. However, the surgery results are dramatic. As in other surgeries though, possibilities of side effects are always there as long as you have enough knowledge in rhinoplasty, and if the surgery is performed well, the surgical risk is not that serious. A dramatic result will come upon you. Thank you.